All right, so this morning we talked a lot about medication, but we're just not only about medication. Lifestyle is medication as well, too. So we're going to switch gears now to talk about some very important lifestyle measures, and we're delighted to have Regina Ragasa, Dr. Ragasa here today. She's a family medicine physician at Panorama City, where she now serves as the chief of obesity medicine. Frustrated with the worsening of her patients' chronic conditions, she was inspired by a colleague, Dr. Stephen Lewenda, who was a longtime hypertension champion with us for many, many years and really pushed us actually to start incorporating lifestyle much more significantly than we had been. So we really owe a lot of credit to Steve. But she was inspired by him to learn more about the benefits of lifestyle medicine, and she became certified in 2020. She's worked with the Center for Healthy Living on establishing 2 successful plant-based programs in English and Spanish and has personally taught the course in both languages. Dr. Ragasa is the regional co-chair for lifestyle and obesity medicine and works with her colleagues to expand lifestyle medicine for all of us. So we're delighted to have you today and look forward to your talk.
This is on, yes? Okay, cool. I like to walk around. Sorry, AV guy. Okay, so thank you so much for having me here, and thank you for the kind introduction. I'm incredibly honored to be able to share this information with you all. I have a lot of information in here, so we're just going to go ahead and get started. So obviously, today we're going to go over and kind of define hypertension, although by now I'm sure all of you are pros at this. We're going to describe the fundamental pillars of lifestyle medicine, which we kind of touched upon earlier today, but I'm going to review them again. We're going to go through the research supporting lifestyle changes to treat and prevent hypertension, and we're going to do a deep dive into nutrition and how that can benefit hypertension as well, and then how you can apply these things that you're going to learn, or little pearls, in your very busy clinic. So we went over this multiple times already. You already know what's pre-hypertension, what's a perfect blood pressure, so I'm not going to spend any time on that, but rather I'm going to focus more on the pillars of lifestyle medicine. So lifestyle medicine is a relatively new field of medicine where we use therapeutic lifestyle changes to actually treat and prevent chronic diseases. Unfortunately, about 80% of our chronic diseases can be treated and prevented if we were able to apply these practices. So it relies on 6 different pillars, and these are the pillars up here. A lot of these you're actually familiar with already, but I'm just going to remind you of some of those. We know that we always try to emphasize exercising for our patients 150 minutes per week, and it should include 2 days of strength training. In terms of risky substance abuse, or substance use rather, we know that with long-term use of tobacco use, it increases the risk of lung cancer as well as emphysema. And then in terms of alcohol use, that's going to increase our risk of fatty liver and eventually lead to cirrhosis. So we always try to counsel our patients to not do that. I think in most recent years, we've come to appreciate how important it is to practice mindfulness as well as meditation and self-compassion. And I want to re-emphasize the self-compassion piece of this because I think we need more of that for ourselves as physicians. We're just kind of perfectionists. We want to do everything perfect for our patients. And I think we need to recognize that our patients do appreciate all the work that we do for them. So definitely a round of applause for all of you guys. Healthy relationships. I think COVID has definitely highlighted how social we are and how that's really important to our well-being. So there's tons of studies to support that we do need those social circles to support us. Sleep. I think this is the one thing that we take for granted a lot, especially as physicians. Most of us are probably not getting the recommended 7 to 9 hours of sleep every night, but we'll see why that's important. And then for nutrition, from a lifestyle perspective, we always promote more of a whole food plant-based diet or a whole food plant predominant diet. All right, so we're going to go ahead and just dive into the studies behind this. In terms of sleep, sleep is super important, right? Unfortunately, you can increase your risk of hypertension if you have sleep duration by 20%. You can, if you have trouble sleeping, let's say you're having some insomnia, you're tossing back and forth, staring at the ceiling, you can increase your risk of hypertension by 45%. And then sleep disorders like restless leg syndrome and things like that, it can increase your blood pressure or increase the risk of it by 33%. So the way this kind of works on a mechanistic level is that when you have impaired sleep, it increases the sympathetic tone, which then in turn increases your blood pressure levels. Ideally, your blood pressure is supposed to drop about 10% while you're sleeping, but if you're having poor sleep, that doesn't happen. So your arteries don't get that rest that it's supposed to get either. Poor sleepers have also been shown to have increased inflammatory markers like CRP, and unfortunately, that also leads to increased risk of heart attacks as well as mortality. For mindfulness, this is a really cool study. This was a study looking at, it was a meta-analysis of mindfulness-based stress reduction program. So they were teaching people how to reduce their stress with mindfulness. And they found that when people were able to practice this, they were able to reduce their systolic blood pressure by 6 points and diastolic by 2.5, which is kind of equivalent to some of the drugs that we're using. And this was sustained through all the way through 6 months. One of the other great benefits of this mindfulness practice is that not only were they able to lower their blood pressure, but they were able to decrease their depressive and anxiety symptoms. This is another study I wanted to highlight, which was transcendental meditation. So mostly to kind of talk about, like earlier today, we were talking about racial disparities and such. This was a study done in African-American subjects, particularly focusing on inner city health. So it was a 3-month randomized controlled single blind trial conducted in a primary care setting. And they were randomized to 3 different arms. They were either just given a pamphlet to kind of learn about this on their own, or they did progressive muscle relaxation, and those were classes that were taught to them, and then they had transcendental meditation. And of the 3 arms, the one that had the most impressive drops in their blood pressures was actually from the transcendental meditation, with the men dropping their blood pressure by 8 points and their diastolic by 4 points. And more impressively, in women, dropping 13 points and 6 points for the diastolic, which is really, truly impressive and just goes to show that when you're living in this really difficult environment, that unfortunately you're in a high stress world, but you're able to control those stress levels, even just through meditation, can make a huge difference in your own health. Social connections, this was kind of fun. So when women, they looked at older women and they found that people who were more at risk for developing high blood pressure were those who were non-partnered or had limited social participation, so less than 2 activities per month, small social network, and their blood pressure difference was about 3 millimeters mercury. Interestingly enough, and I don't know how to explain this, it was an increased risk for men who were partnered or co-living with other people. I don't know. I don't have any good reasons for that. All right, when it comes down to alcohol and blood pressure, this was a great meta-analysis. Basically, they were doing different dosings of alcohol, high dose, medium dose, and low dose, and you can kind of see what the servings are there. And they found out there was a really biphasic nature with all of this. And basically, in the first 12 hours after consuming alcohol, your blood pressure decreases, which is kind of nice. But then there's this rebound afterwards in the second 12 hours, I guess. So that's not exactly good for us. So you kind of wonder a little bit: is this good for us? Is it not? Should we be drinking all the time so that we can have that low blood pressure? Well, when you look at more studies, basically it shows that heavy consumption of alcohol increases the risk of hemorrhagic strokes and cardiomyopathy. So leaning towards the no. We also have other studies that support that excessive alcohol intake and binge drinking patterns actually contributes to arterial stiffness. And then there are some short-term trials that show that when you stop alcohol, it does reduce the blood pressure, but unfortunately we don't have long-term studies that continue to show that. They just haven't been performed, not to say that it doesn't actually help. And then lastly, there are some other studies that suggest that maybe low to moderate intake can be cardioprotective. So I don't have a hard and fast rule about this. I think if we kind of stick with the low to moderate intake, I think we're probably safe. Or if you want to be safest, maybe we should avoid it altogether. Okay, now let's get to good stuff. So if anybody knows me here, I love nutrition, and that's what we're going to talk about next. So I really love this comment by Dr. Greger. I think it's a bit swarmy, but I love it. He says, the cause of high blood pressure isn't medication deficiency. The underlying cause is what you eat and how you live. So we're going to talk about that. Oops, that went back a little bit too quickly. One of the first diets that we always recommend to our patients when we're talking about high blood pressure is the DASH diet, right? Everyone's really familiar with this. The DASH diet stands for Dietary Approaches to Stop Hypertension, and it was established in 1997. In the DASH diet, we really highlight the whole grains, more of the lean meats, vegetables, fruits, low-fat dairy products, and then most importantly, we really want to limit the sodium. They highlight 2,300 milligrams per day, but they find even better results when you limit it to less than 1,500 milligrams of sodium in terms of lowering your blood pressure. So to dive into this a little bit more, where the heck is this salt coming from, right? If we're supposed to only consume 2,300 milligrams a day, do you know how much the average American consumes? We had talked this about a little bit earlier, that most Americans have surpassed this significantly. And so the average American consumes 3,400 milligrams per day. That's 50% more salt than we're supposed to be consuming, okay? So where is this coming from, though? Are we adding it from table salt? Where is it coming from? So 5% of the salt is coming from when we're cooking. Not too bad, okay. 6% while we're adding, so that's the salt that you're adding to your wife's meal or whatever. 12 is found naturally in fruits and vegetables, so yes, you will get what you need through that stuff. And then the last 77% comes from processed foods and restaurant foods. So it's not necessarily how you're cooking, it's probably what you're buying, if that's the processed foods or the pre-prepped meals or when you're going out, right? And I don't really I don't really blame restaurants for putting all that salt in there. They're just trying to make a buck, and they're like trying to make the food taste really good and make you come back. But unfortunately, we get so used to that we just, when we start cooking at home, maybe it's not as amazing as that restaurant, but they're probably not paying attention to how much salt they're putting in there. Okay, so I think this is a big take-home tip I like to teach my patients is I want them to, if they're gonna buy processed foods, I want you to know how to read ingredient lists, or not ingredient lists, but the nutritional label. So the way to tell that if something is low sodium is to look at the milligrams of sodium per serving, and that number should be less than the total calories per serving. So we're just gonna take these tortillas as an example, and you have over on the left-hand side, you have just regular old flour tortillas. In the middle, you've got your whole grain, and then you got corn on the right-hand side. And I have here, I blew up the number of calories so you can kind of see that. And so let's highlight what the normal flour tortillas is in terms of sodium content. It's 410 milligrams of sodium, so this is considered high sodium. Previous to me learning about this little tip, I would have thought, okay, well, we should go with the whole wheat because that's probably better, right? More fiber and all that good stuff. Whole wheat is at 330 milligrams of sodium, so that's about 5 times the amount that it should be. And then the one that actually wins is actually corn tortillas. It's only 20 milligrams of sodium. So whenever my patients tell me, hey, I really want to eat tortillas, or maybe they're trying to avoid, I'm like, listen, eating tortillas is not a bad thing, but I want you to kind of eat the one that's as most whole as possible. And corn tortillas are actually quite whole. And the added benefit is there's not much sodium in there. So that helps on multiple levels. And here's just another example. Let's just look at black beans. So with black beans, we're looking here, the calorie content is about 110. And then here I have highlighted that sodium is 140. So technically this is slightly high in terms of sodium. But if you are able to rinse the beans after you dump them out, it actually cuts the sodium in half. So now all of a sudden it's good and it's not high sodium. So that's what I would recommend. All right, just by show of hands, I don't have a Mentimeter here. Which of these things here do you think contains the most sodium? Do you think it's 1 serving of beef, 3 ounces of beef? Do you think it's 1 serving of baked all-natural chicken? Is it large McDonald's fries? Or D, 1 serving of salted pretzels? So I'm just gonna go through that again. Show of hands for beef. Got a lot there, okay. Chicken? None for chicken, okay. McDonald's fries. Yeah, I see a lot. Yeah, I would have guessed that too as well. What about pretzels? Anything for pretzels? Yeah, right, there's salted pretzels. There's more than salt. All right, guys, drum roll, chicken. What? I know. So unfortunately, it is common practice to inject saline to increase the weight of these chicken breasts. And when you inject saline into these chicken breasts, it increases the weight, so you pay more for them, and it happens to be juicier when you eat them. So yum, right? So when it is injected with the saline, it can contain up to 840 milligrams of sodium per serving, okay? And it can still be labeled as all natural because the definition of all natural is no artificial ingredients, no added colors, and it can be minimally processed, which includes smoking, roasting, freezing, drying, fermenting, grinding, etc. So if you choose to buy chicken, just make sure when you look at the back of the package that it doesn't contain more than 70 milligrams of sodium per serving. And if that's the case, it's probably not injected with saline. All right, so let's go back to the DASH diet. I just wanted to go into a little bit of history behind this. So back in the 1920s, there was this really fabulous study. We talked about this earlier, and Dr. Batiste had said, hey, animal proteins can actually increase the risk of blood pressure. Well, that was actually proven in the 1920s. And they said that they found that if you added meat to a plant-based diet, it increased the blood pressure in just a few days. And then in the 1970s, you have here Dr. Frank Sachs, and we'll see why he's highlighted in a little bit. But he did his own study, and the same thing. He found that increased blood pressure levels were associated with the consumption of animal protein. So Dr. Frank Sachs, by the way, is the guy who actually headed the the formation of the DASH diet. So despite all of these research findings, plus his own, why is it still part of the DASH diet? Y'all want to know the truth? You can't handle the truth, okay? The truth is, he knew that a plant-based diet was the way to go, but he said the goal of the DASH diet is to create eating patterns that would have the blood pressure lowering effects of a vegetarian diet, yet contain enough animal products to make them palatable to non-vegetarians. So he wanted to promote a diet that would be more acceptable, but that's not optimal, right? So if you look at the DASH diet very closely, there's minimum recommendations and then the maximum recommendations. So just as an example here, you have whole grains. It says you should consume about 6 to 8 servings of whole grains a day. If you're looking at vegetables, 4 to 5 servings for the whole day. One thing I wanted to point out is when it comes to sweets, you don't need sweets, right? It says less than 5 per week. You could get away with 0 and you'd be fine, right? So not necessary. When it comes to meats, there's that fine print again. Less than 6 servings per day. It's not necessary. So this is kind of how he got away with it and how we have unfortunately misinterpreted it, right? We're not telling our patients you should have 5 servings of sweets every week, right? No, we're telling them avoid them as much as possible. So same thing. All right, so this is a study that highlights that differences in how animal proteins can affect our chronic diseases. So in this case here, compared to non-vegetarians, they found that semi-vegetarians were able to lower the risk of hypertension by 23% compared to pesco-vegetarians. So those are people who consume fish and still have dairy products in their lives. They can reduce their risk of hypertension by 38%, so that's wonderful. Compared to lacto-ovo vegetarian, they can lower their risk by 55%. And then the best of this is the vegan group. And the vegan group happened to lower their risk by 75%. What about exercise? This is the one pillar I kind of left off a little bit earlier on. This was a really interesting study here. I think exercise can be protective, but to a certain extent. Without the dietary changes, I think we're still somewhat at risk. So this study looked at to compare sedentary omnivores versus omnivorous endurance athletes versus sedentary vegans. And these vegans were mostly whole food plant-based, not eating like the vegan junk food, okay? So here are the numbers. With sedentary omnivores, their average blood pressure is about 132/79. And from our lectures today, that puts them in the stage 1. And then we have omnivorous endurance athletes, definitely improved though, right? These athletes have about a 10-point difference compared to their sedentary omnivore cohort. And by the way, these people who are doing these omnivorous endurance athletes were running on average about 48 miles per week. Okay, so it's a lot of exercise. And again, this puts them in the pre-hypertensive category despite having better numbers compared to the sedentary omnivores. And then compared to the sedentary vegans, again, I'm not promoting people to just sit on their tushes, but they were the only ones with the normal tensive numbers. It was 104/62. And again, I just want to reemphasize, this is not junk food vegans. These are the people eating more unprocessed foods. So let's talk about superfoods for hypertension. These are amazing superfoods, and we're going to go over the studies that support this. We got the whole grains, we got flax seeds, we got hibiscus, as well as nitrate-rich vegetables. So in terms of whole grains, this randomized controlled trial basically gave the control group some refined grains versus whole wheats versus oats. And they found that over time, the people consuming the wheat and the oats, fared better in reducing their blood pressure by up to about 6 points by the end of 12 weeks of consuming this diet. I wanted to kind of also point out here that the blood pressure drop is almost like additive. You know, the longer you did this, the more improved the blood pressure got. In terms of flaxseed, I think this is my favorite study of all the things I'm going to show you today. This is a double-blind, placebo-controlled, randomized control trial. And what they did was they gave muffins, which were the control. They didn't really have anything other than bran and molasses, and compared to the experimental. And the experimental muffins had about the equivalent of 1 tablespoon of flaxseed. And each person was supposed to consume this every day. So they tracked them over 6 months, and they all kind of started off with higher blood pressures of like 150s over 80s. And in the control group, not much change, no surprise, right? And then the experimental group, it actually dropped by about 10 to 15 points. What is that? 7 points for the diastolic. So all in all, we're looking at flax seeds, just the consumption of 1 tablespoon of flax seeds daily to decrease the systolic blood pressure by 15. We were talking about a drug today that dropped the systolic blood pressure by 13 points. I think we can start telling people to put flax seeds into their oatmeal in the breakfast, right? Compared to calcium channel blockers as well as ACE inhibitors, I mean, it's pretty superior, I think. Okay, when it comes to hibiscus tea, so if you want something kind of tasty, this was a really great trial too. It was a randomized, double-blind, placebo-controlled clinical trial. And basically, they took patients with prehypertension or mild stage 1 hypertension and wanted to see if this tea would actually help lower their blood pressure. And they did find that hibiscus tea was able to lower it. What they had to do was, though, they had to drink 8 ounces of hibiscus tea 3 times a day, which might sound a little excessive. I don't know. I mean, 8 ounces, I guess, is not much. And it was able to lower the systolic blood pressure by 7 millimeters mercury by 6 weeks, pretty quick. The only thing is, it is a bit acidic. So if you're going to recommend this to your patients, make sure they rinse their mouth with water afterwards to reduce the acidic effects on their tooth enamel. All right. Blueberries. I have a couple studies on the blueberries. This is a single-blinded study where they basically had patients consume 2 cups of blueberries daily for 8 weeks total. And they found that their blood pressure was able to drop pretty significantly in the blueberry versus the control. Here's another study basically showing the same thing, that 22 grams of freeze-dried blueberry powder versus control powder showed that there was an improvement in blood pressure levels. So this is the control, basically no change in their blood pressure versus the blueberries, about a 7-point drop. So, it might kind of sound like I'm cherry picking some data here. So there was, actually before I get into that, why blueberries are awesome. So blueberries are awesome because they're rich in polyphenols, they improve digestion, brain function, blood sugar levels, prevent blood clots, and even cancers. They have lots of antioxidant effects, can enhance your memory, and prevent neural function decline. So lots of great reasons to consume the blueberries beyond just, your blood pressure. But again, going back to the cherry picking, somebody wanted to see, okay, well, what does all the research show? So there was a meta-analysis about this, and their conclusion was there was no significant blood pressure effect on blueberry supplementation. And it's like, oh, that's kind of a bummer, because it kind of sounded good. But when you look at the studies about the ones that supported blueberries and having their positive effect on blood pressure, those were the blueberries that were prepared with water versus the studies that were prepared with yogurt or milk were the ones that showed there was no improvement. So there was actually another study done to compare those two exactly. They're like, is can milk actually prevent the good side effects of blueberries? So they did that. They combined 200 grams of blueberries plus 200 grams of water versus 200 grams of blueberries plus whole milk. And the way they were measuring this to see, how much of these phenolics they got in the blood, they were specifically looking at caffeic and ferulic acid. And they found that with the black bars are showing that there's higher levels of the blueberry plus water. In that combination, you would find more of the caffeic acid and lower levels when it was combined with milk. So there was something about combining it with milk that would make it more difficult for your body to receive the antioxidants that you're supposed to get through it. And this one also highlights the same thing with different formulations of milk, skim milk versus whole milk. And they found that it was most suppressed when it was consumed with whole milk. So maybe it has something to do with the fat content of the milk that doesn't allow you to absorb all the antioxidant effects of blueberries. Let's talk about nitroglycerin. So as docs, we're very familiar with prescribing this, right? And basically the way it works, I think all of us know this, it helps to relax the smooth muscles so that we can open up the blood vessels and provide more blood flow, right? So this helps out our patients when they are having a little bit of chest pain and can be very helpful to them. So in terms of that, I wanted to go over nitrate-rich vegetables that may have similar effects. So this one in particular just was a study done on beet juice. They basically fed 2 cups of beet juice to these subjects versus water, and they found that within just 2.5 hours of consuming beet juice, the 2 cups, they were able to drop the blood pressure level by 10 points in systolic levels, and then around 3 hours, pretty close after, their diastolic was able to drop by 8 points. A slightly lower dose, this one is a double-blinded, randomized, placebo-controlled trial as well. This was just 1 cup of beet juice versus a nitrate-depleted beet juice. So somehow they're able to take the nitrates out, and that would be a relatively fair comparison between the two. And everyone started with, relatively high blood pressures. And similarly, after a 2-week washout period, they were fed these drinks daily, and they found that their blood pressure continued to drop over the weeks and with the lowest drop of 8 points at the 4-week mark, and then they had another washout period. And similarly, they had the lowest drop at 4 weeks for diastolic blood pressure at the 4-week mark, with dropping it by 4 points. So just a summary of different types of nitrates that you can find with your plants. Beets, surprisingly enough, are kind of on the lower end per 100 grams. So this is milligrams of nitrates per 100 grams of that fruit or vegetable. So beets are only 110 milligrams of nitrate per 100 grams. And as you go through the chart, you can see Swiss chard has a lot, oak leaf lettuce, beet greens, basil, and at the very, very top is arugula. And if you were thinking about beet juice, by the way, like 1 cup of beet juice is equivalent to half of the amount of the arugula, so around 200. So it's still pretty high and easy to chug down, which is kind of nice. All right, so I wanted to bring up the canary in the coal mine. A lot of us know that with men, it's the first thing, one of the first symptoms that they might come to and complain to us about, right? We know that they need to have patent arteries in order to have strong erections. And the reason why this is the canary in the coal mine as one of the first signs of potentially increasing the risk of heart attack is because the arteries within the penis are only 1/4 of the diameter of the arteries within the heart. So if that one's getting clogged up first, next is your heart, right? So now knowing all this information about the nitrates, I think we should really encourage our male partners, and if you are a male partner, to really eat that salad for a fun time, okay? All right, so just a couple case studies. This is Ms. Papagallo. She's an 80-year-old woman. She's this cute little Italian woman. I'm not doing much with her other than just like, hey, you've lived your life, you're amazing, just keep cruising, right? But I was counseling her daughter who was struggling with her weight and diabetes. So of course I'm teaching her the plant-based diet as well. And she inadvertently went plant-based with her daughter because she cooks for the both of them. And unfortunately, 3 weeks later, she ended up in the ER. It was because her blood pressure was too low. So we actually had to remove the hydralazine off of her. I'm not saying everyone's gonna reduce their blood pressure that dramatically, that quickly. Oftentimes it does take a little more time than that, but she was kind of a dramatic case for me. So I always like that one. This is Miss Ragasa. It's actually me, it's Dr. Ragasa. So this is my own personal story. When I first became pregnant, that was the first time right around that time I was transitioning to a plant-based diet. And I remember my first appointment, they said, you know what, you really should not try any new diets when you're pregnant. And I was like, you know what, I don't know enough about this. You're right. I'll just go back to eating as clean as possible without going plant-based. So they convinced me to keep a pescatarian diet. I still kept my eggs and cheese. During this pregnancy, unfortunately, I ended up developing gestational hypertension, which was no fun. They sent me to the hospital. I was like, no, it's my ET time. I don't want to spend time here today. And then, after doing more and more research about this, once I became pregnant with my second one, I decided, you know what, I know enough about this diet that I know I can have a healthy pregnancy eating a whole food plant-based diet. So no one could convince me otherwise. And after hearing all these lectures, they're like, no, don't talk to her. You're not going to convince her. So I kept a whole food plant-based diet. And surprisingly, and even though I was older, I was able to be normotensive through the entire pregnancy until I ended up in labor and delivery, and they decided to take my blood pressure when I was having contractions. That is not fair. I think that should be illegal. And they're like, your blood pressure's high. I'm like, yeah, no way, duh, of course. I'm popping out a baby, it hurts. Just also want to share with you, despite the two very different diets, both kids ended up being 7 pounds. So totally healthy. Maybe I'll warn people against the whole food plant-based diet because my second one's a little bit crazier than the first one. So I don't know. All right, so how are you going to be able to pitch this to all of your patients, right? You have your 20-minute visit. How are you going to do that in the 5 minutes that you have with the patient because they're 15 minutes late? I had to find a way to be more strategic about this as well. So I have a 2-minute elevator pitch that I started telling and sharing with my patients. And what I usually tell them is I want them to focus on high-quality proteins. So as soon as they say high-quality proteins, they're on board because everyone talks about protein, right? And then they're like, yeah, I got you. And I'm like, yeah, no, it's not the fish, it's not the eggs, it's not chicken. They're like, what's left? And I'm like, beans and lentils. You should eat your beans and lentils. And I'm like, I never thought about that as a protein. But as soon as I kind of introduce it to them that way, they seem pretty open. And then I tell them, listen, I don't need you to be 100%. I want 80, 90% of the time. And I think you're going to be really successful with this. And one word I love to drop is that when you eat this way, it reduces inflammation. I feel like all of our patients, when they hear that, they just love that word. I feel so inflamed. I got so much inflammation. How do I get rid of it? But once you tell them that once you start switching out your proteins for the beans and lentils and reducing inflammation, they are on board. Okay. I also don't say plant-based in the beginning because unfortunately, this is synonymous with like veganism nowadays. And they might think you're snooty and you're trying to put, maybe put some agendas on them. And I also avoid saying plant-based because unfortunately it's been hijacked by so many processed foods, right? You go into the market, you see the plant-based meats and plant-based products everywhere, including Oreos are technically plant-based. So it reduces the confusion. And I often tell people, listen, I want you to eat food that looks like it grew from the ground. And if it looks like it grew from the ground, that is fair game. If it looks like it was highly manipulated by human beings, you probably want to avoid it or just save it for a special occasion. And oftentimes that's a lot more easy to digest, no pun intended, than just saying plant-based. And I forgot to mention, this little QR code that I have down here is a video that I created for my patients because I wanted to give this type of lecture to them, but it takes 30 minutes to do that, to try to convince them and educate them. So this QR code is specifically tailored for weight loss, but if you want to share that with your patients, you can. It's not, I guess, KP okayed. It's purely my content. This is stuff that I would have told my patients anyway. So if you're kind of curious about what I teach my patients, that's it, basically. Okay, and some of you might be thinking, okay, that's all fine and dandy, but what about our patients who live in those food deserts, right? It can be really difficult to access those foods. So try to make it accessible, which means tell them it's okay to have the canned fruit and canned vegetables. You really want to choose the ones that are low sodium, reduced sodium, so that they're not consuming the high sodium foods. If you're going to get the canned fruit, make sure it's canned in water or even light syrup. You can even rinse it afterwards so it doesn't contain all that sugar. And then frozen fruits and vegetables are totally a great option. You want to make sure, of course, if you choose those vegetables, they're not already seasoned in other sauces, right? Because otherwise they're pre-prepared foods. Oftentimes these frozen fruits and vegetables are picked at their peak, so they're very high in their nutrient level. So actually a really good source for our patients. This is where I want to highlight pills versus natural foods. We, as physicians in primary care, I'm assuming a lot of us are in primary care here, how often do we get that patient that says, doc, if you could just give me 1 more month, I'm gonna exercise, I'm gonna eat well, I'm gonna do all these things so I don't have to take that pill, right? And I know you've negotiated with them. You're like, all right, you come back, we'll see what it looks like. But if they don't know how to get that down and they're just going by whatever they see online, do we really expect them to improve, right? So we need to teach them what that means to treat themselves with those whole natural foods. And I'm pretty sure a lot of your patients would appreciate this information. And then the other thing, we talked about this earlier with the other speakers, try to leave your biases behind you. I know that's really hard to do. I know when I first learned about whole food plant-based, I will not lie, I was definitely biased with my patients. I was picking out the younger crowd who would be more receptive to this information. And forget it, if you're a white male who's from the Midwest, I would not tell my meat and potatoes guy that. But that's not really fair, right? It's not like you would say, hey, you shouldn't get a blood pressure medication because I don't think you're gonna take it, right? We need to give all of our patients this chance. You don't know who's going to be receptive to this. I've actually convinced a white male Midwesterner to actually change his diet, and I saw his cholesterol drop within a week. He was very skeptical, but he wanted to prove me wrong, and he didn't. So anyway, I advise you to share this information with them. Meet them where they're at. You don't have to tell them to be 100%. Maybe you just tell them to start with like 1 meal a week. See how it tastes, you know? Maybe they like it, maybe they hate it, and it's okay. Try a different recipe. And know that when you're making these changes, as small as just replacing 3% of your protein can actually reduce your risk of chronic diseases by like 5% or something like that. I don't have the exact numbers. It's part of another presentation I had. But it's helpful, and I think all of our patients deserve this information. So again, I don't expect all of you to be experts on this, so if you want to share this information with them, we do have smart phrases that are available to everyone, so if you type in .diet_rec English, and we also have it in Spanish. I know you can't read this, but it basically explains what a plant-based diet is, what are the benefits of it. You have 2 QR codes listed there. One QR code is a little pamphlet that we hand out to our patients, but an electronic version. And then the one on the right-hand side, that's 14 pages worth of recipes and resources for patients to explore. And then lastly, we have classes to support our patients as they transition their proteins. So this is a really helpful resource for our patients. Another thing you can do is you can do a referral to health education. We don't have a button for plant-based classes yet, so I just put in weight management or whatever you like, whatever you're scheduling them for. And then in the comment section, I would just put, please schedule for plant-based diet classes. And of the medical centers, these are the ones that offer our intro classes, and 5 of those medical centers offer follow-up 12 to 16-week series to help them through this, very similar to the format of Healthy Balance. Another great resource is our Emmy videos. This was actually created by NorCal. And it's a 20-minute video that goes over whole food plant-based versus vegan, what's the difference between them, goal setting, incorporation, FAQs, and testimonials. And if in case you are curious about what those videos look like, there's a website right down below that you can take a picture, type it in yourself, and that way you don't have to assign the Emmy to yourself and watch it like the way I did. Okay, and then lastly, I didn't have enough cards to put on everyone's desk, or in front of everyone's table, excuse me. But this is a QR code that you can scan, and it's 5.5 hours of CME that is completely free. The White House has recognized that we are in a crisis. Too many of us have too many chronic diseases. And we've recognized that the way that we can help prevent this is to teach people how to eat properly. So if you scan that QR code, there's 5.5 hours of lifestyle medicine right there so that you can learn and feel more confident while you're teaching your patients how to transition their meals. So my main takeaways, lifestyle measures, when combined, can have a very powerful effect on lowering blood pressure. The DASH diet, we should really be aiming for less than 1,500 milligrams of sodium per day. Try to keep animal products to a minimum if you're going to include them, and then try to focus on whole plant foods. So that is the end of my talk, and thank you very much for your attention.
Outstanding presentation. Thank you so much. Any questions? There's one in the chat about flaxseed. Does it matter if it's whole versus ground?
Good question. With flaxseed, you should have it ground. So you can either grind it fresh yourself and really kind of get the most of it. I'm very lazy, so I just buy it ground. And what I do to preserve it is to keep it in the refrigerator. And that way it lasts a little bit longer.
There's a lot of interest in the hypertension community around replacing sodium-based salt with potassium-based salt. I know we prefer to get our potassium from whole foods, but thoughts on that?
Yeah, actually, there are some studies on that too. And when you do end up doing those salt replacers with the potassium ones, we do see that there is a decrease in the blood pressure. So you can recommend that to your patients as well. And sometimes it can affect the way that your food tastes. It's not exactly the same as regular salt. So sometimes you can do half and half. And even by doing that, you're able to cut down the salt intake for patients.
All right, any last questions? Excellent, thank you so much. Wonderful presentation.